Hi, my name is Kel Helmuth, and I'm doing a presentation on mastitis in lactating dairy cattle. So let's start off. What is mastitis? Mastitis is a intermammary bacterial infection. Is what causes mastitis. It's contagious. There's two different types. There's contagious versus non-contagious, and it is contracted by bacteria that lives on the skin and udder, that then eventually colonizes the teat canal. And the main two strains that are in contagious mastitis are Staphylococcus aureus and Streptococcus agalactitate. And then, and contagious mastitis is able to be spread from cow to cow, which is why it's important you sterilize equipment. And then non-contagious, there's lots of different types of bacteria that cause it, but here's some common ones. We got Streptococcus uberis, some coliform forming bacteria like E. coli, and then Pseudomonas aeruginosa. So those are causes of mastitis. So as you can see in this video, this is a dairy cow that attends her dairy. Her name's Angel, and she has mastitis in her one quarter. And here I'm stripping out the teat, and you can see there's some chunks that are coming out. And here in this picture is just showing, you can see some chunks on there on the concrete. And so here are some things that we can do to prevent mastitis. Clean bedding is important, as if the bedding is dirty, it's easier for the bacteria to live in that, and it can easier get into the teat canal and cause mastitis. A big thing is cleaning and sanitizing of milking equipment, especially if you have contagious mastitis. And the most important thing we do to prevent mastitis in dairy cattle is called pre-dip and post-dip before milking. And I will touch more on that in just a second. And the times that are most common for cows to contract mastitis are in the first month of their lactation, when they're milking really heavily, and they also when they're later in their lactation, they're not giving as much milk. So here's some milking procedures. So like I said, we have pre and post milking dip, which is an iodine solution that we dip on each teat before and after after they're milking, just to sterilize and kill any bacteria that are on the teat that when milking could get into the teat. So, and we call it dip, strip, wipe. And I will show a video of this here. So you dip the teat with teat dip, and then you strip it, which is you pull a couple strips of milk out each teat, and then you take a rag and you wipe each teat down afterwards. And this also, by doing stripping, especially each teat, it allows us to inspect to see if there's any signs of mastitis coming on, which is a big thing that can help us. So here is just a teat dip, like I explained, the iodine solution. And then in this video here, I'm showing is what we call a dip, strip, wipe. So I'm dipping the teats with the iodine solution here. And then I'm stripping some milk out of each teat just to make sure there's no chunks, and we can inspect each cow. And they kick a little bit, sometimes it causes some discomfort. And then here is a rag. I'm wiping off all the manure and everything that's stuck on the teats. So the dip helps sterilize it. So non-lactating dairy cows are what we call dry cows, and cows are dried off about 6 to 8 weeks prior to calving. And so these cows can get mastitis. And so to prevent these cows from getting mastitis, since they're not being milked, we put a non-toxic sealant in their teats that is in a little tube, and we inject it into the teat, and just keeps bacteria from getting into the teat. And then at the time of when they have their calf, you strip the teat until that silicone comes out. So here's just the teat sealant that we use on dry cows. It's just called Dry Shield, just a little injector tube. So that's prevention. Now, what happens if you have a cow that does get mastitis? And so here's some different treatment options. And so there's many different types of antibiotics that you can use. And so the main two that are used in treating mastitis would be intramammary antibiotics, and then just your general systemic antibiotic. And if you catch it soon enough, a systemic antibiotic, a broad spectrum antibiotic, like cetrizole is an antibiotic that can be used, and you give that with a painkiller like Banamine, and that could clear it up right away if you catch the mastitis early enough, which a very common form of that antibiotic is the brand name is called XNL. And XNL, is a broad antibiotic that you don't need to hold milk if you give it. You can it has a very short half life, so that's why it's used to treat mastitis, because you can still, if they get over it, you don't have to hold milk from the cow for very long. And then also, if they are getting signs of mastitis, we can do things like pain relief, which is like with the Banamine, just to help their body heal from it and fight the infection. And then another option we can do is just something for udder discomfort, which is like a lotion, like a mint lotion that we rub on the udder, just like it's like icy hot or biofreeze for the udder, just to give it some more comfort. So this is the XNL I was talking about, just a broad spectrum antibiotic that has a short half-life. And here's the Banamine. It's just a painkiller. This is the off-brand version, and both of those combination works good. Here today, it's a just another intermammary one. And here's Spectromast. This is a intermammary antibiotic we also use. And here in this video, you can see us administering the Spectromast right into the teat. So that's how it would have looks like. Angel doesn't like it too much, but it just goes in there and it clears it up. And here's the udder mint I was talking about. It's just like an icy hot kind of for the udder. It just helps alleviate. And so pain. A lot of people are worried about milk with antibiotics in it. And so milk that has antibiotics in it does not ever go to the store. So I'm going to touch on here on milk with antibiotics. And so when a cow is treated with antibiotic, their cow is banded to identify that they have been treated, and that their milk has to be dumped. And so when milking their cow, we hold the milk in we milk them out instead of going into the pipeline, going in the bulk tank. We plumb it into a separate little milk jug that we then keeps it out of the bulk tank, and then everything else is sanitized after we milk that cow. And so all antibiotics have withdrawal periods, and withdrawal periods are dependent on what type of antibiotic you're using. Sometimes it can be 2 weeks, 1 week, 5 days. It all depends on what antibiotic you're using and the half-life of how soon the body can metabolize the antibiotic and it can get out of the system. And so milk that does have antibiotics in it does not go in the bulk tank like I mentioned. And if it does get in the bulk tank, we have to dump the entire bulk tank and clean out everything. And so the whole bulk tank is dumped if there's signs of antibiotic. If there's a treated cow died into, the whole bulk tank is dumped. And if the bulk tank isn't dumped and it has treated milk, the milk truck driver will come get a sample of the milk, and if the milk has antibiotics on it, it will be tested, and if it shows antibiotics and it was in the milk trunk, then the whole truck has to be dumped, and that farmer will have to pay for that whole truck of milk being dumped. And so this is just ensures, and the milk is tested at various different locations, and so this just ensures that milk at your store contains no antibiotics. So here's just a picture of us holding the milk in that separate jug right there on the ground, and then here a secondary video. So here's it's just plumbed in a different way, and you're just holding the milk. And so that is mastitis in lactating dairy cattle, and those are just a general overview of what mastitis is, and just from prevention and treatment tips and information. So thank you.